annual stroke update. So this is something new that we tried last year for 2025, and we hope that it would be interesting to the community, and we will try to produce every year. And Diana is going to give us some insights about this new kid on the block. Thank you, Diana.
Thank you, Georgios, for the introduction. So indeed, in these last minutes, we would like to introduce you to this new format of the ESO documents, and really to explain you not exactly the content there is in the last publication, but what is the framework and what is the gap that we are trying to fill with this new type of review. So indeed, the ESO Annual Stroke Evidence Update 2025 was just published in February and corresponds to the review of the year of 2025. These are our disclosures. They are detailed in the manuscript. So we know that stroke medicine, and we see that very well in this conference, is filling in with a lot of new evidence. High-impact studies very quickly are published in large quantities, and so this makes increasing the decision-making increasingly complex for stroke physicians all across the world. And we are aware that appropriately there's a delay between producing the evidence and doing guideline updates, because it is a complex process, as we have been seeing, and indeed there is necessary time and also a lot of effort to do these updates. So we are aware that there's this period of time since the results are presented and published, and then they are integrated into the evidence-based recommendations, where physicians have variable access to the information, and also have, it is quite variable the way it is implemented, interpreted, and assessed into the implementation of in clinical practice. So this is the gap that we are trying to fill in with this type of initiative. It is coordinated and performed by the Guideline Board. It aims to be an annual review, and the idea is really to review the most relevant new evidence published or presented in large conferences in the last year across all the stroke care continuum, so all the topics. And I want to highlight that in this paper, we won't have recommendations, so it is not a guideline. It is really just an expert consensus between some people on what has been the most important evidence just presented and published. The idea is to provide a rapid access and some critical appraisal, and also highlighting some of the gaps in the evidence of this emerging data, while we will be working on the formal incorporation together with all the remaining evidence into the new evidence-based guidelines. So it is really just a selection of the evidence, and but we highlight some potential implications that this specific study may have for future, for clinical practice and future guideline development. So how do we do it? We do a systematic screening of the main journals related with stroke, and also the main journals in medicine, and conference materials from the main stroke conferences. Also within the guideline group, we do have people with very different backgrounds, so it is very useful to have the within board suggestions for studies that are particularly impactful. We cover ischemic stroke, ICH, CVT, central retinal artery occlusion, and also we cover all these topics, including imaging, rehabilitation, systems of care outcomes, so going from acute to chronic treatments. The studies are then shortlisted by a group of domain leads, so each of the members has a specific domain he is responsible for, and then there's a review and an opinion by the other members on what should be the studies included in this review. And the criteria to include in the review are the methodological quality, the potential clinical relevance, and the impact in future guidelines. So this year, this was the group that was involved in doing this review. I thank very much all the members involved. And overall, what we do is that we provide a summary of the key findings. There's a table with potential practice-relevant implications of that specific study, not necessarily from all the evidence in that field. We also highlight problems in those studies and knowledge gaps and future research priorities, hoping also to guide research in this field, and that is ongoing as well. As I said, we cover all these areas from acute treatment to systems of care and rehabilitation and cognition and dementia. And here I can show you, but I really invite you to read and to see to the publication and what are the offering of this type of review. So here I show an example. So table 1, it is the core findings by domain. You can see that for diagnostics and imaging, we have studies that have been looking into multiparametric CT in IVT eligible patients. We have the study on the trial on extended CTA, including the heart. We have evidence on the new technique of photon counting CT. We have observational data on intracranial artery classification. We have also, we mentioned a standardized reporting, a new standardized reporting framework for imaging research. So you see it's not only trials, it's different types of evidence that are also used to highlight the most important evidence in these specific fields. For example, of course, for acute ischemic stroke, we have we discussed the studies on endovascular treatment of MEVO, also extended time window thrombolysis, use of tenecteplase, and so on. So we have tables for all these areas, acute ICH, secondary stroke prevention, also the mention to new reports from pharma companies, such as was the case still last year of asundexian. So all this data is reviewed, both RCTs, relevant observational data, individual patient meta-analysis, and other types of standard reporting and guidelines. Then the second table, you can find indeed the key messages from these studies, and also the type of study from which was derived, and the direction of the evidence. So you can see, for example, for extended CTA included in the heart, it was a potential benefit. So you see the arrow above. And then if it is a negative or a neutral, you will see the corresponding symbol as well. So, and you also see the type of evidence, either RCT, meta-analysis, individual patient meta-analysis, or observational data. So overall, our aim is to have this new ESO product, new ESO document, integrated with the other types. So you have the ESO guidelines for evidence-based recommendation based on formal methodology. They provide direct guidance for clinical practice, and indeed they are only applicable for some areas where evidence is available. Then for areas where the gaps cannot be covered by the guidelines, we do provide practical orientation and expert consensus statements through the ESO white papers, which is also a recent new format, kind of a consensus statement. And then we have this new format, which is the annual update, where you can find a very quick structured synthesis from very recent evidence, some expert appraisal, and then you can use it also to inform clinical thinking in daily life and individualized decisions and research. So in conclusion, we hope this will be an additional tool useful for all of you and all clinicians working in stroke care around the world, and also to highlight knowledge gaps and research priorities for research. Thank you very much, and I'm happy to take any comments or questions.
Yes, please.
Gabriel Rinkel from the Netherlands and Germany. Thank you so much for this very good initiative. I think it's very helpful. And I thank you for all the work that you do for providing it. Nevertheless, I would like to give one suggestion to give you a little bit more work, but to look not only to ischemic stroke and intracerebral hemorrhage, but also to aneurysmal subarachnoid hemorrhage. Thank you.
That's a very good point, and thank you for highlighting that. Indeed, we try to have a large coverage, but we should pay more attention to topics that are within cerebrovascular disease in general. That's true. Thank you so much.
Then if we have no question, I think it's time for you, Diana, to close the session.
Well, if there are no other questions, so thank you very much for coming to this session. We look forward to see you next year also for the next guideline session, and please enjoy the rest of the conference and have a nice day.
To cry.